Now, for those not familiar with intracranial EEG, these pictures can look a little scary. They look a little wild, and that's because they kind of are. The scalp electrodes that we put on the scalp to record EEGs, these are those actual electrodes, but they are on the brain itself. Now, why would anyone want to do that? So there are a couple reasons why. The most common reason for intracranial EEG is for epilepsy surgery. Not just any surgery, but resective surgery, meaning we're going to go in and take out the part of the brain that's creating the seizures. To do this properly, you can't just use scalp electrodes. Taking out a piece of someone's brain is kind of a big deal. So you really have to confirm where the seizures are coming from. And so we do something called an intracranial EEG, where we actually, open up the skull, put the electrodes on the brain, record some seizures, and then we can figure out where the seizures are coming from and if that area of the brain is an area that you can take out to help someone with their seizure frequency. Now, the second reason you can do this, and it's less used, is to record seizures that aren't showing up on scalp EEG. To be honest, I've been doing this for quite some time, and I don't think I've seen that used too much just because it's not that practical. The most common reason we do this is for surgery. Now, what if your seizures are coming from a place that you can't take out? Well, you can still use data from intracranial EEG to figure out where to put something called an RNS, or a responsive neurostimulator device, and we can talk about that in a different video. But there's a lot of options that are available once you have this data, because you know exactly where your seizures are coming from.